right, and there's Mr. Mattis Castillo. And welcome everyone. We're going to get started on today's workshop on the COVID-19 Racial Equity and Community Engagement Response Team. For today's presentation, there's going to be a lot of information. And so we ask that folks, as much as possible, hold your questions to the end. If there's a clarifying question on a particular slide, go ahead and raise your hand. But for the most part, the bigger picture questions and policy inquiries, if we could hold those to the end, that would be great. That way we make sure we have all the information before we start asking questions. And with that, I will turn it over to County Manager Ryan O'Connor to start us off.
Thanks, Madam Chair. On behalf of everyone here today from RESERT and across the county, we appreciate your time to talk about our work. Some of this should function as a reminder or a recap on work that's been done. Other pieces may be parts that in the depths of COVID response over 12 months, you may not, this may be the first time you hear about it or first time you're able to really dive into that specific area. Today is less about specific policy recommendations coming out of some of the work, which has been a huge part of our work with RESERT and the Equity Action Circle. And it's more focused on the structure, process, and learnings to date, with the final slide serving as a recap of some of this important work. I will end with a thank you right away to Sarah and Prince and me in particular, as the racial and health equity administrators who will play a large role here today. It's tough enough standing something up on the fly, particularly on a topic as fraught in America as racial equity. It's even tougher during a pandemic. And then when you're asked to report to the county manager and you figure out how do you navigate across other areas and how do I not step on other people's toes but still get the work done. At every turn, they have shown grace and intelligence and grit and a vision moving forward and an unwavered commitment that's been a big part of our success. And they'd be the first to say that it takes hundreds of people to be able to contribute to that success, and a board that is willing to let us do things differently and acknowledge our past ways of error. But at the end of the day, you got to have people there at early in the morning and late at night to help get it done. And these three REAs, as they're known, the Racial and Health Equity Administrators, have absolutely done that. And so with that, I'm going to turn it right over to them to begin the presentation. They didn't know I was going to thank them on the way in, but I wasn't going to waste that time. Looking forward to listening today, and I'm going to jump off the screen to give you all a little more headspace together. Thank you.
Thank you, County Manager O'Connor. Good afternoon, Madam Chair and Commissioners. This is our agenda for today's workshop on racial equity and community engagement response team. My colleagues, Sarah Holly, Prince Corbett, and I will be presenting today. And then also we're hoping for the last end of our presentation that we can have a discussion and next steps. So next. And so I would say before we move into the presentation today, I just want to take a moment to acknowledge that Ramsey County sits on Dakota land. This is a unique opportunity to pause and also be mindful of the past and its impact on our current work and future work. And so I'm gonna just take a few moments here to read our land acknowledgement statement. Every community owes its existence and vitality to generations from around the world who contributed their hopes, dreams, and energy to making the history that led to this moment. Some were brought here against their will. Some were drawn to leave their distant homes in hope of a better life, and some have lived on this land since time immemorial. Truth and acknowledgement are critical to building mutual respect and connection across all barriers of heritage and difference. We are standing on the ancestral lands of the Dakota people. We want to acknowledge the Ojibwe, the Ho-Chunk, and other nations of people who also call this place home. We pay respects to their elders, past and present. Please take a moment to consider the treaties made by the tribal nations that entitle non-Native people to live and work on traditional Native lands. Consider the many legacies of violence, displacement, migration, and settlement that bring us together here today. And please join us in uncovering such truths at any and all public events. So I just wanted to also that this acknowledgement was given in a U.S. DAC Honor Native Land Guide, and it was edited to reflect Minnesota tribes. And the statement was in review with St. Paul Indians in Action and endorsed by Shannon Gesick, the Executive Director of Minnesota Indian Affairs Council. Next. So today, so the purpose of today is to learn more about the work of our Racial Equity and Community Engagement Response Team and our Equity Action Circle, or EAC, today. Also to review, research and EAC key racial equity priority areas and themes identified, and also to discuss future EAC engagement opportunities to work ahead to advance racial equity, shared power, and engagement. And then I'll hand it over to Prince Corbett.
Thank you so much, Administrator Chang. So if we go to the next slide. We really wanted to, with the work of research and the Equity Action Circle, is really built on the foundation of our Advancing Racial Equity and Community Shared Power strategic priority, and built on our Ramsey County value of equity and our prosperity goal to cultivate economic prosperity and invest in neighborhoods with concentrated poverty, which are typically our racially and ethnically diverse communities. COVID-19 didn't just put a spotlight on the current racial and health inequities that exist, but rather it put a stage light on those racial disparities that we are working to address and end. The Racial Equity and Community Engagement Response Team and the Equity Action Circle are innovations to our county operations and governance as we seek to reduce the racial inequities while deconstructing organizational and systemic barriers that have historically subsided the voice of our racially and ethnically diverse communities. If we go to the next slide. And really wanting to acknowledge that with the COVID-19 pandemic, there were many government jurisdictions across the country who were considering how to address the COVID-19 racial inequities. Many of these jurisdictions embedded their racial equity officers or their racial equity teams inside the emergency incident command structure or the incident management team. Some of those jurisdictions included the city and county of San Francisco, Los Angeles County, the city of Long Beach, Portland, Oregon, Louisville, Kentucky, and Seattle King County Public Health. As you all know, we have been doing a lot of work to advance racial equity prior to COVID. As the Racial and Health Equity Administrators presented our research framework to address the racial inequities during COVID to our county manager, he was very adamant that we should not lose ground of the racial equity work that we have been working on prior to the pandemic, and didn't want the racial equity work just to focus on the COVID-19 emergency. So rather than having research report to the incident manager inside the incident management team, our county manager had research report directly to him. Research is led by the Racial and Health Equity Administrators and supported by 13 other county employees who are redeployed up to 50% of their time to focus on this work. One important aspect of research members is that members represent all levels of the organization, from frontline staff to managers and including deputy directors. The Racial and Health Equity Administrators, or REAs, made recommendations of staff to be research members, and members were approved by department directors or the deputy county managers, and we'll share more about the research members later on. And shortly after we formed research, we wanted to make sure that we really centered community voice. And in centering community voice, we were working on developing a racial equity community advisory committee. That Racial Equity Community Advisory Committee, now known as the Equity Action Circle, consists of 15 community members who really center the voice around community with regards to not just our COVID-19 racial equity response, but also to some of our operational racial equity initiatives and responses. And so the organizational structure really just shows how research and the Equity Action Circle is connected to the whole organization within the incident management team and our normal operations as well. And next slide. So to provide some historical context about how we came with research, it's kind of hard to believe that we've been inside this emergency for a year now. And when we first went into, when Ramsey County in Minnesota first got our first case of COVID that was confirmed back in March, Administrator Holly and myself were paying very close attention to any jurisdictions that were reporting any racial data when it came to COVID cases or COVID deaths. And during the first week of our declared emergency, there were only 3, maybe 4 jurisdictions across the whole nation where we could find any data when it came to COVID deaths or cases with the racial data. And then the following week, there were 8 jurisdictions who were reporting out any racial data with regards to cases and deaths. And we were able to take that information and share it with our then Director of Public Health, Kathy Hadeen, now Deputy County Manager, to say, Director Hadeen, this is the data that we have in all 8 jurisdictions that were reporting COVID cases or deaths with racial data. There were inequities in every single jurisdiction. And so we took this data to Director Hadeen to say, hey, we know that somewhere within the state, the racial data is being reported. Can you push on our state department or Minnesota Department of Health to really help release that racial data so that we can know, so that we can start tracking the racial data so that we could get ahead of those inequities? And it was Deputy County Manager Hadeen who graciously made that plea to the state of Minnesota, which I really believe is one of the reasons utilizing the data that we had from those 8 jurisdictions to start releasing the racial data. So to get ahead of any racial inequities, we put together a framework for research, which was launched in April of 2020 for the COVID-19 pandemic response. And the role of research was really to focus on those 4 focus areas around data and evaluation. So we quickly realized that the racial inequities of COVID just was not around the transmission of this virus and the deaths caused by this virus, but it spread into employment, it spread into our small businesses, it spread into public health, it spread into so many other areas. So how do we utilize data to really influence the decisions that we're making? With communication and messaging, how do we work on being effective with communicating the racial inequities caused by COVID-19, not only to our community and residents, but to our staff people as well, so that as decisions are being made, people are aware by the data that's being influenced around how to make decisions? How do we effectively outreach to our community, ensure that our community, especially our racially, ethnically diverse community, have the proper messaging, have the proper information, understanding that some communities simply do not trust government? How do we ensure that messaging that we share is culturally and linguistically relevant? How do we ensure proper interpretation and translation services? And then how do we ensure policy and systems change during this pandemic? And if you're like me, if you was to think back a year ago, personally myself, I didn't think a whole year later we would be dealing with this emergency as well. But this is why research was developed, to ensure that the racial equity component in the lens is there, to ensure that the voices of our racially, ethnically, and culturally diverse communities are really centered. And next slide. And wanted to share, we talked about our research members that are representative of various departments and service teams across the county. And we wanted to ensure with research that it was included representation. And just wanted to lift up Ken Peltol, who's the Economic Growth and Community Investment Representative. Within the Health and Wellness Service team, there's Amy Zhang, Kamala Jaglau, Sarah Mayat, Key Vang, and Kari Umanzar, who's a backup. For Information and Public Record Service teams, for the Information and Public Record Service team, there's Kasong Gang and Allison Winters. For Safety and Justice, we have Nina Harris from the County Attorney's Office. And from our strategic team, Derek Thomas, Maria Sarabia, and Lydia Germa. So these are the wonderful county staff people who really have worked hard to make everything happen. And it's not just the racial and health equity administrators, but it is a teamwork effort. And for the next slide, I'll turn it over to Administrator Sarah Holly.
Thank you, Prince. Thank you, Madam Chair, Commissioners, and County Manager for having Research here today. We're really excited to share this information with you and the work that we've been doing in community and with community. And so there's been a tremendous amount of work over the last year. And so we wanted to lift that up today on behalf of Research, as Prince has mentioned, and our Equity Action Circle, and all the community partners that we have worked with very intentionally over the last year. This timeline in front of you really captures the key milestones and accomplishments over this past year. And one that I want to highlight before taking a deeper dive into some of the initiatives listed here is the collaboration and immediate, I want to really stress, immediate discussion that we had with our Equity Action Circle regarding the memo to the state on the 1415 building. And I'm just lifting that up because we're going to take a deeper dive into some of the other initiatives that are listed here on the history and accomplishments and timeline. But this memo was really focused on concerns from the community with the state's intended use of the building, recognizing that the community wanted to have input in that and engagement. And so that was kind of our kickoff to input and requests and that co-collaboration between Research and the Equity Action Circle. And Commissioner Castillo and Commissioner Carter were engaged in those conversations along with our county manager. And so that I just want to point that out as one of the first areas of focus that we really took heed to and supported community on. And so again, take a look at this timeline if you have time. There's a lot of information here. This timeline highlights the work of Research that we did with our trusted community partners, our work convening, planning, and leading community town halls and conversations. I think that many of you have attended since March of 2020, the Mask for Everyone initiative, and our important work with the Equity Action Circle to really co-develop strategies and solutions to meet the unmet needs of racially and ethnically diverse communities and residents during our COVID-19 response. Next slide, please. Madam Chair and Commissioners and County Manager, we wanted to take a moment to kind of pause. There's been a lot that has happened over the last year, particularly related to the CARES Act. And so Research right at the beginning was engaged in this process, but today we want to really lift up what occurred in the summer of 2020. Research launched its work to partner with community to get information back out to our residents and our key stakeholders during this response to prevent the spread of COVID. That was one of our first items of action as a team, to really wrap our arms around how do we get public health messaging out to community in partnership with our public health department team, outreach team there, and also our communications department. And so this slide really talks about the process. And so we leaped into the funding process and engagement, and we kind of had some set focus areas based on community-informed recommendations from our earlier work in the food and basic needs and housing stability engagement at the start of the pandemic. And so Prince and I really leaned into that and learned from community and took a lot of that information around the importance of getting messaging, as Prince mentioned, getting having community conversations and having trusted people really working in community to aid the county in this work. And so we grew this work based on that information, and it really helped inform our funding process, not only for phase 1 of the Research initiatives, but also phase 2. We've had this iteration and feedback from community that we've continued to try to pivot from based on their ongoing input. And so for both funding opportunities, we leveraged the emergency procurement process to expedite funding, to really get that funding and these initiatives off the ground and in community. And so again, I can't stress it enough that we were working in partnership with community to really aid the county in our public health response. Along the way, we convened panels of community reviewers that included the Equity Action Circle to gather feedback on our selection process for our community contractors and partners, both for phase 1 and phase 2. And so we kept that community engagement and that intentionality around centering community voice, even in the funding process. With the CARES Act funding, we were able to support the Research phase 1 and phase 2 initiatives, which included our Trusted Messenger initiative, our Media Messaging initiative, our Cultural Community Connector initiative, and our Community Conversation projects. We worked with our lead evaluator, Ms. Sarah Maya, to develop an evaluation process that involves community feedback and reflection each time. So we're really proud that we had community at the table along the way, and we took that feedback and really tried to pivot, as I mentioned before. I want to briefly mention that we were really heavy in partnering with Deanna Pesic and the compliance team around how we did this work in partnership. And so for compliance and monitoring parts of this work, we provided technical assistance and contract monitoring to 51 agencies from July of 2020 to date. And we did that in partnership, like I mentioned, with procurement, finance, our compliance team, but also I have to really give a shout out to our research team. People stepped up in ways that were amazing to support our community partners. You'll notice that I'm not saying community contractors because these are really partners in the work that we're doing in community. We developed a process to hold learning community sessions during the month of July and August to really, again, pivot in the work that we were doing. We learned a lot there, and we actually did make some changes in real time to how we were communicating information with the community and on behalf of the community with our trusted partners. And we provided that ongoing TA for phase 1 and phase 2. We actually leaned into that a lot more during phase 2 on making sure that we had continuous technical assistance meetings with community. We developed an invoice guidance and letter of interest process to reduce the barriers to funding and to gauge interest of our partners. We worked with our partners to gather required CARES financial documents and information for the reporting purposes. And we did that by having a key contact at the county, Ms. Amy Zhang, to make sure that if community had questions or concerns, we had somebody that they could directly contact during that time. Next slide, please. And so I want to lift up this fabulous work. And if any of our community partners are here today, so much has happened in the year, but this is, I would say ReCERT is most proud of not only the Equity Action Circle, but the work that we've done as a part of our funding initiatives. And so, as I mentioned, the Trusted Messenger Initiative was one of our first initiatives. We worked with about 15 agencies to execute contracts between July of 2020 and September of 2020 to ensure that individuals and families were engaged and had accurate and up-to-date COVID-19 information. And so we partnered with trusted agencies and individuals in the community to do this work. The next initiative that we focused on was media and messaging. And so this was really aimed at providing culturally specific, relevant, and linguistically appropriate and accurate media services and communications back out to the community. And we also did that with trusted individuals and agencies in our community. And so we partnered with about 12 agencies during that same period of time. As I mentioned before, we launched those learning community sessions for our community partners and with ReCERT. And we analyzed the feedback from our community partners with outcomes of learning shared back in our ReCERT evaluation report. And I can't say it enough, Madam Chair and Commissioners and County Manager, that we really took that reflection, that time to reflect on the work, not only with community, but with ReCERT so that we could continue to improve the work during this emergency. Next slide, please. So the second phase of funding occurred between November and actually we just wrapped up the end of February with our phase 2 ReCERT funding. And we learned a lot of lessons, like I mentioned, around the Trusted Messenger and media messaging project. So we actually merged those two because of what community told us, what was working, what was not working, how maybe it was confusing at first around the differences of the two. And so we really launched this work with 21 trusted community members and agencies to provide those media and engagement services that aided the county in getting COVID-19 information and messaging to residents from November of 2020 into February of 2021. One of the other things that we learned directly from our Equity Action Circle healthcare community, which Ms. Chang will cover later, is that the community was really looking for a community connector, a lay health advisor, someone that people could trust if they had questions, if they needed information, if they needed resource connections during this time. And so we launched our first COVID-19 Cultural Community Connector initiative, and we funded 9 trusted community members and agencies to provide that accurate and timely COVID-19 education/information, to do outreach in their communities, and to provide those resource connections and referrals back to the county, but also with our residents. And so that could have been county services, it could be community services, but we really knew that there was a gap there in people really making sure that people knew where to go if they had COVID, if they had community members that were struggling or family members that were struggling with making connections to resources during this really difficult time. Next slide, please. I want to give a shout out to Commissioner Ortega. This initiative, the Community Conversation Project, was really a request of Commissioner Ortega. And we listened, and we listened to community during this time. And so I'm smiling because it was so important that we launched our Community Conversations Project. And we funded 16 trusted community members and agencies, again, from racially and ethnically diverse communities to gather input and knowledge on the community's perception of COVID-19. And it was really, the goal here was to really help inform the county's response. And so we did this from November to February. And right now, Ms. Sarah Mayat is taking a look at that information. And so we can continue to pivot and inform our process and response to COVID-19 with our health department and with a number of internal partners and external partners. What you see on the screen are some images of our community partners and the communication that they sent out to get people to those spaces and places virtually to have these conversations. And so one is Macklemore Holdings. This was one of our community partners that was working with youth and young adults during this time. And then we have HACED, which is another organization that works with our Hispanic and Latinx community that was hosting a community conversation around COVID-19. Next slide, please. This last slide just gives you the names of our contracted community partners. And so overall, we had 52 contracts with 45 community partners since June all the way to date. And so we just want to lift up the agencies that are here on the screen in front of you. We had representation from our African-born community, our Black ADOS community, our American Indian community, our Asian and Pacific Islander community, our Latinx and Hispanic community. We even had representation from our youth and young adult community because we were looking at the data and the impact that COVID was having on our community. And so congratulations to our community partners for this phenomenal work during a really difficult time in our lives. And so thank you all for partnering if you're here listening today. We really appreciate the work and dedication and partnership that we've had with our community partners over the last year. I'll turn it back over to Administrator Chang. Thank you.
Next slide, please. And for research, one of our focus areas was around tying it back to our community engagement and outreach focus area. Research partnered with county departments to host virtual town halls and community conversations, really to listen to community, respond to their questions, concerns, and recommendations, but also to share county resources and programs during the height of COVID last year. And so research partnered to host more than 20 community conversations and town hall to share information and gather community feedback. And the topics varied from financial assistance. I think I remember our very first one was in May around to get community feedback on our emergency assistance and emergency general assistance funding that Tina Curry and her team were doing. So that was one of our first town halls that we had, ranging from, I think we went through the gamut of the health and wellness service team, departments within the health and wellness service teams. But more than that, I think those conversations led to having monthly conversations with our public health medical director, Dr. Lynn Ogawa, around how can community keep themselves safe, but also learn from community what are some myths and concerns that they have in the community that our county, as a county, how do we respond and message our how to stay safe to communities of color who have concerns around transmission, around masks, wearing masks. And so really learning from the community and also responding in real time with in partnership with our communications and community partners on how to get those messaging out to our communities of color. And another initiative around community engagement and outreach that we did was the Mask for Everyone initiative. Sia, can you go to slide 16? And so this initiative was to ensure that individuals and families and businesses had access to a mask and that they had up-to-date and accurate information about the importance of wearing a mask and also like instructions on how to properly take care, how to use the mask and care for like washing and taking care of your mask. And so we utilized our emergency procurement informal quote process, procurement process to contract with 30 community partners to make homemade masks. And alongside the alongside the homemade masks, we also had donations. And so starting in August of last year, we've distributed more than 90,000 masks and at two events. We also held two events in the community where communities can either reserve masks and come and pick up, or they just do a walk up. And so those events were highly successful. I think we had more people show up to those events that we had staffing for, but I think that was where that was the importance. People wanted more information, and I think the relationship that we had with our community partners also really helped promote our events. And so we were able to reach so many people across Ramsey County. And even today, while we're not doing those events, we continue to accept mask requests. And so we do deliver them through the mail as well. Prince, do you want to take the next one to transition?
Yes. Another research initiative when it came to data and analysis is we had developed the racial equity impact tool. And this is an interactive live map that is available publicly that looks at within Ramsey County, various communities that are least likely to economically recover from a pandemic. And when you look at the map, essentially the darker shades of census tract areas are the neighborhoods that are least likely to recover to economically recover from this pandemic. And what it looks at is three factors, and those three factors are race, income, and age. And it looks at the percentage of residents within a community that identify as Black, American, Indian, Latinx, and Asian American. It looks at communities that have more than 20% of an area's households within the 200% federal poverty level. The percentage of households living in rental properties that are 50% or more. It looks at residents who reside less than a half a mile from a grocery store. And then it looks at also another impact area of residents within a neighborhood that have more than 14% of residents being the age of 65 or older. And I will say that this tool actually was created by King County, Washington's Office of Equity and Social Justice. So King County, Washington was one of the first jurisdictions that was impacted by COVID. And Ramsey County, we have been a part of the Government Alliance on Racial Equity, or GARE for short. GARE has started a COVID-19 Rapid Response Coalition. And we have been attending meetings during the first part of this pandemic. And that's where we learned about King County's tool. So we took the data that King County had used and modified it a little bit so that we were able to take the data that they use, have it specific for Ramsey County with regards to those areas to create this map. And we had an opportunity, and I would say King County actually partnered with Headwater People Consulting to create this racial equity awareness tool in King County. And we had an opportunity, our research members back in May actually met with Janine Anzalata and the King County Office of Equity and Social Justice staff, who was able to present and share lessons that they learned from around this tool. And initially in King County, they utilized the tool to identify when they were setting up hospice sites or COVID sites for individuals. Community members were upset with where those spots were placed at, because it appeared that they were placed in very racially, ethnically diverse communities in King County, Washington. And this is one reason why they created the tool. How we was able to utilize that tool in Ramsey County specifically is when it came to the CARES funding for emergency and rental assistance, and the marketing needed to go out. our communications team and our financial assistance services team was able to take this tool and really identify what specific neighborhoods they should send communication out to. So that's just one example of how we were able to utilize this tool, and also an example of how through the GEAR network, we were able to connect with another jurisdiction on the other side of the country to be able to lean on their knowledge and expertise as they had experienced this emergency first. And we can go to the next slide. Another research initiative has been our Early Childhood Education Initiative or project. And I want to lift up one of our former employees and colleagues, Nancy Lee, who had been leading a lot of our early childhood work over a number of years. And Nancy had brought it to our attention, and Nancy was like, Prince, I just gotta say that as we're spending like all of this CARES money, there's a group of individuals within our county that we completely forgot about in our pre-K kids. And I was like, Nancy, you are absolutely right. Understanding like the racial inequities that currently exist within our education systems and the impact of COVID, especially with our pre-K kids who may not have access to learning material and learning education and educational products during COVID. So we were able to support the educational needs of up to 1,300 pre-K children with a $300 Lakeshore Learning Voucher. Parents who were awarded vouchers were able to go to Lakeshore Learning, order up to $300 worth of educational products for their children ages 0 to 5 in the household. We had 2,700 plus parents or caregivers who applied, and we only had the application open for about a week. We did do targeted outreach to our low-income families receiving services. So we actually had shared information with our MFIB employment counselors, Minnesota Family Investment Program employment counselors at Workforce Solutions. We shared the information with our SNAP and WIC staff over in public health and our home nursing program staff who actually do a lot of outreach. So there were 871 families who received the vouchers, which is roughly 1,300 children. And that's because multiple children in the household were eligible. So if one family might have 2 or 3 children who were under the age of 5, they were eligible. And in addition, there were over 100 vouchers that was issued to our families who are residing in our emergency shelters. And we really wanted to focus on our racially, ethnically diverse communities. And as you can see, well over 60%, close to 70% of the families who received the vouchers were from racially, ethnically diverse communities. It's interesting that 15% of the parents who received vouchers were under the age of 24. And then 75% of the children were between the ages of 1 and 4. So really supporting that early childhood piece. So this was one initiative, and parents and the responses that we got were just grateful for this opportunity because they were wondering, like, how can they support their children and their children's learning needs during this time? And for the next slide, I believe it's being turned over to Sarah Holly.
Thank you, Prince. So that wraps up our research highlights and initiatives over the last year. And now we want to pivot to our Equity Action Circle work that's happened in partnership with the 15 members that we've gone on this journey with since May. And so since May of 2020, Research has worked with community members who were identified and selected by a group of residents to work with Research and the county manager to really co-develop strategies and solutions. And our goals here were really to be able to incorporate and align community identified recommendations to meet the unmet needs of racially and ethnically diverse residents during this pandemic. And to then take those recommendations under consideration and incorporate those community identified focus areas into the work that we're doing at the county. And so those focus areas, those 5 focus areas that we'll talk about very shortly, were identified during this journey together. And so back in July of 2020, we worked with the Equity Action Circle to further identify a group of up to 30 community members to co-create and co-develop strategies in partnership with research with our 15 Equity Action Circle members in these 5 areas of focus. And so family and youth was identified by the Equity Action Circle as a focus area. Healthcare, housing, policy and practices, and workforce were the 5 areas of focus. And so within those 5 areas of focus, there were topics that the Equity Action Circle and the committee members, who were also residents and community partners that joined EAC during this time, identified specific focus areas or goals within the 5 areas of focus. And so the goal here was to really, take time to learn and review and evaluate the work that was happening at the county, to lift up the scope of COVID-19, as Prince mentioned earlier, and to really take time to review, evaluate, consider how we could incorporate those community identified focus areas into the work that we had already been doing as a county, but specifically during our COVID-19 response. And so without further ado, next slide, please. I want to introduce our Equity Action Circle members. Again, we have 15 members that we meet with currently on a bi-weekly basis. At the start of the pandemic, we were meeting on a weekly basis with our 15 valued and diverse and talented members who are from our community, again, since May of 2020. And so I'll just read really quickly who our members are: Ms. Elfrida Flowers, Ms. Dawn Blanchard, Ms. Hillary Lohr, Dr. Javi Maldonarez is one of our members, John Thompson, Ms. Laura Dorn, I should say Representative John Thompson, sorry about that, Ms. Laura Dorn, Ms. Marika Reese, Elder Mary Kay Boyd, Dr. Mohammed Alfash, Mr. Richard McLemore, Dr. Rodolfo Beatriz, Elder Snowden Herr, Dr. Suzanne Matson, Dr. Tamara Madison, and Mr. Thomas Berry. And so we've been actively working with our Equity Action Circle members who may be joining us here today and listening in to this board presentation. So I just want to send a huge thank you for all that we've accomplished together, for your vision, and for making the Equity Action Circle a true success this year and hopefully beyond. Thank you. I'll turn it back over to Administrator Corbett.
Thank you so much. And what you see before you is a timeline history of the Equity Action Circle accomplishments over 2020. And definitely a whole lot to read, but I'm not going to read everything, but just highlight a few different key accomplishments that the Equity Action Circle has been involved in. I think one of the key things early on is providing the community input and recommendations regarding CARES funded projects when it came to workforce programs, emergency rental assistance, and small business relief programs. So departments had met with Equity Action Circle members with regards to CARES funded projects to be able to get that community feedback, to be able to understand community feedback with the racial equity lens, and being able to pivot as departments were setting up programs and pivoting from programs. And then also at the suggestion of Martha Falson Community and Economic Development, the EAC participated in providing input into the Economic Competitiveness and Inclusion Plan. So Denitrik Powers from NAO Partners actually have presented the Economic Competitiveness and Inclusion Plan to our EAC members to be able to get the feedback, their feedback. The Equity Action Circle supported the preschool development grants from Minnesota Department of Human Services and wrote a letter of support for that grant. And they also wrote a letter of support for the Upper Mobility Metrics grant that was applied through the Urban Institute. And I would say one of the last things to kind of highlight is that one of our EAC members recommended a book called With the People that was from the Kettering Foundation. And this small but powerful book really provided a lot of insight regarding how governments and community can really work together to really help solve the problems. And that book is With the People by David Matthews of the Kettering Foundation. So a lot of things on there, but just a few things to highlight. And as we transition to the next slide, Mi Chang is going to talk about the EAC recommendations.
Yeah, I'll just provide high level a high-level overview of the Equity Action Circle recommendations. And so, in the fall, summer to fall of last year, Research worked with the Racial Equity Action Circle to co-develop and create a set of recommendations for the county to consider during COVID response and beyond. And so for our family and youth committee, really their goal or focus is around the family coach model to address families' needs in a holistic way. For our healthcare committee, really just working with us the goal is working with the county to increase reach and effectiveness and COVID messaging. And so that, at the beginning was really around testing and how do we stay safe to testing. And now it's to the COVID vaccine. And so kind of moving along as we, I think those messaging are in real time and reflects what the work that we're currently in present time. Our EAC's housing committee is really focused on preventing evictions and supporting communities. Our policy and practices committee is focused on identifying key recommendations and outcomes for procurement, engagement, and accountability. And then our workforce committee is focused on improving workforce outcomes for internal employees as well as our residents. And so I think, as the racial and health equity administrators, we're working closely with our EAC as well as connecting some of the recommendations and goals to align with existing work that's happening around the county. And so there are many opportunities where, as we think about where this fits in, my colleagues, Prince Corbett, Sarah, and I are working to align where work can be, working to connect where those work can align and with our departments and our county leaders as well. And so there's more to, I think we're in a space where we're still making those connections. And so with the priority recommendations that our EAC has given us, we're looking at making those connections and how do we move forward.
Ms. Chang, can I add a point really quick about what you said?
Go ahead.
I just want to also say that there are points in some of the recommendations that the Equity Action Circle has made in the broader report that's here on the screen. So we like visuals, as you can see. So we have the Equity Action Circle report that's available. And there was also a memo that was written in response to the report that went back to the Equity Action Circle from County Manager O'Connor and the research team, responding to areas like Mia had mentioned where there are opportunities. I do want to mention though that within most if not some of the recommendations, we have made progress and we've tried to pivot, as we mentioned earlier, particularly like with the healthcare committee. We took that idea, right? An idea, a need, an identification of a focus area, and pivoted to really create a pilot or a trial run on what would our community connector initiative look like. So what would it look like in community, on the ground, right? And in partnership with community. So I just want to lift that up, that we did take some or most recommendations to heed right away to see how we could further operationalize, embed, and align, make those connections, as Mi Chang has mentioned, right away. And we're still building on that as we speak. So I just wanted to lift that up and mention that we did some kind of immediate focus, and now we're looking more short-term and long-term at the recommendations report. Thank you, Mi.
And then Prince, do you want to close it out?
Yeah, yes. So moving forward, the next steps, and this is looking at the work that's coming up and for the rest of 2021. About the work that Research and EAC will do. And it's really working with departments to facilitate opportunities and conversations around the shared priorities. Of those recommendations within that report, within those 5 priority areas, working with community, our Equity Action Circle, as well as our departments and department directors on really advancing those recommendations, designing, implementing. Some things have already been designed, as Administrator Holly has shared. Some things are in the process of implementing, but really centering community voice and community priorities around initiatives, especially when it comes to racial equity that we're moving forward. It's working with our public health on the equitable distribution of the vaccine. And I know that's a huge concern for a lot of our commissioners and a lot of our residents is how do we help ensure of those residents who want to get vaccinated, ensuring that we are reaching more diverse residents who are getting vaccinated. And I would even say with that, we know that there are residents and community members who don't want to get vaccinated, but also ensuring that public health messaging of those residents who choose not to get vaccinated around staying safe and continue to wearing masks. And also ensuring that, like, even as people get vaccinated, that people are following the recommendations set forth by the CDC and public health around wearing masks, and developing that shared process around short, medium, long-term approaches to help ensure successful implementation of these efforts. And these efforts and initiatives with the recommendations coming forward from the Equity Action Circle, I would say are definitely their recommendations. And I want to lift up the priority areas that were selected by the Equity Action Circle were selected by them. We went through a process of doing a consensus where it was not county government systems people deciding, but they decided through the consensus process of what those priority areas are. And then it's an interesting thing of learning how do we work together now in cohesion to move these recommendations forward so that they're not just recommendations, so that this doesn't become a report that sits somewhere archived somewhere years down the line, but actual action steps and actual changes that we're working to implement going forward. And next slide. And just a few key takeaways for everyone is recognizing the racial equity of impact goes way beyond the spread of the viruses, death, and vaccination. And initially, when we lifted up this work, it was looking at how do we slow the spread of viruses in our racially and diverse communities, and how do we not be on a report that comes out of when it comes to racial equity, when it comes to deaths, we didn't want Ramsey County to be there. But we realized that it spreads way beyond that. It spreads to food and basic needs access. It spreads to employment, access to technology. It spreads to like so many areas. We also recognize that community engagement is just one method of advancing racial equity, which is when we combine the strategic priority from community engagement and advancing racial equity community shared power, it was we really want to be intentional with sharing power with community. It is I think a new concept for a lot of people working inside governments around like actually sharing power, because meaning sharing power means that we have to give up some of the power. But if we're truly leading, as we are leading with the residents first, as we have such a very diverse county of residents from all over the world. Like I can say like Ramsey County is truly the melting pot in Minnesota. How do we recognize the needs of diverse communities, of our Karen community, of our Hmong community, of our Lao, Somali, Ecuadorian, so many different communities, and not just engaging with community, but actually sharing the power and saying what it is that you need and how can we make this happen? And to recognize that the enhanced value to programs and services that when we go beyond that engaging power, when we go beyond the community engagement, there is so much more beyond that when we actually share power. And then finally, the structure of research and the Equity Action Circle is really helping develop a future framework for us to normalize, organize, and operationalize our commitment to advancing racial equity. There are a lot of things that we're learning. We've had reflection sessions with our research members, with the Equity Action Circle, that over the past year that we are bringing forward as we're kind of deciding how to reshape, redefine our racial equity framework across Ramsey County. And I believe that is all, and I've truly appreciated it, and open it up.
Thank you.
so much. Oh, go ahead, Sarah.
I was just saying thank you for having research and for having the race equity administrators here today. It's truly a pleasure to lift up the work of this initiative, but of the people, the humans behind the work. And so I just can't stress that enough, that between the research team, all of the partners at the county that we've worked with, that we intend to work with, that we'll continue to work with, but also our community. That has been the most important piece, I think, of this work, is centering community voice and, like Prince mentioned, really being intentional about that and how we share power. So thank you for having us, Madam Chair, Commissioners, and County Manager O'Connor. It's been a pleasure.
Thank you, Sarah, Prince, and me. I so grateful for your efforts and for the time you've spent talking through all of the efforts. And then also thank you to our attendees who aren't in the webinar, but who serve on RECERT and the EAC. So grateful for you and your service and your partnership in these efforts. With that, we do have hands raised, so I will start with Commissioner Carter.
Thank you so much. First of all, it was challenging to listen to a body of work that reflects over time what you all have been doing as research and together with EAC across the pandemic, responding initially in those ways, i.e. whether it was BICS building or emergency assistance dollars, and a number of town halls that you conducted to gather the input of community, structuring of the EAC, and working together with the groups to prioritize and create a report, to having that presented, to having it responded to. There's so much, and we behaved. And we did not interrupt you with questions because you had that last slide that said questions. So we have waited to say thank you so very much. And Commissioner Fretham has also said for such incredible work that you have done as our racial and health equity administrators, and also together with the participation of so many in our community, the contracts, the people that have come to the table. All that you've done has really held us up, as a part of the Ramsey County fabric for ensuring equity and health and wellness within our community during this incredible time. I look forward to seeing the report and the recommendations that have come from the priority group meetings that you've had. And I also look forward to seeing the response from our county manager, and to seeing and hearing how these recommendations are sorted through, continually discussed, and aligned to the work in process in our county. It strikes me that as you talk, for example, about the coach model that has been discussed, that actually answers some of the questions, or has opportunity to answer some of the questions that we were discussing in an earlier workshop today, as we looked with our information and public, I don't know why I keep getting IPR confused. Somebody chime in. Information and public
records. Public records, madam.
I forgot the public before, and I forgot the records this time. But in any case, as it aligns with that work, and it's probably because, that work is now reaching out to our service centers. It looks so different than it did in the past. So reaching out to our service centers and involving navigators and the connection to community, which could include coaches in the future. So all of the thinking that has happened there is just so impressive, and it has been definitely a support to us during this very, very difficult time. You know, and this isn't a question, I apologize, but you also came up during a time when transforming systems together was in plan and about to arrive. And so a lot of what you've done, I'm sure, is informative to that work. I wonder if there are conversations, to the extent to which at this point in time, The work that you are doing is partnering with the building in transforming systems together and informing that work, and vice versa, because of course that is coming up right now at this point in time. Can you talk a little bit about that and what you are seeing as a result of the work you've done on the ground and the work that is being developed there, how they are partnering or conceivably can partner together?
Madam Chair, Commissioner Carter, I'll start a little bit and then on some of the specifics, if the racial and health equity administrators want to jump in, they can. I think the initial structure slide at the beginning matters a great deal. And I think as an organization, behaviorally, we haven't quite even caught up to our structural changes, which is to say, like, I think we start from the premise that we're not going to be talking, but as we've changed structures, created the service teams and deputy county managers, it actually positions, as you look at that chart, the county manager's role in a different spot to ensure that that alignment occurs with the board. Whereas before, I think what often happened, and you heard this from my predecessor, right, is the days got spent just doing the administration of the org to keep it moving, even though you have the conversations on Tuesday. And so you see the side of TST, transforming systems together, and then the work over here of research coming directly in, operational arm and COVID. And that does lead to a unique spot. I mean, if you're counting it, I have 38 meetings a month across all the different report structures, right? Many of which are with you, but then many of which are with those individuals, where the focus is really on that, because you're hearing from today the administrators, you heard from the deputy county manager earlier, they are doing a wonderful job of implementing the work, which allows us to organizationally think of how we organize and connect. A couple quick examples to reinforce for you. The EAC has begun talking with TST, and this is both one of the biggest opportunities and challenges in front of us. They are not the same, but they are clearly closely related. Both care about systems change, racial equity, and transformation. One has a funding mechanism as a tool, more like a foundation in partnership with community, and one has a policy balcony level lens. The funding mechanism could choose to fund some of the policy balcony level lens work happening here. And so just last week, Sarah, Prince, me, Danny, we're spending a lot of time in that conversation of how do you bring that to community members, though, who have never been asked to play those roles either. And we need to make space for them to like do more than hear that one time. And that's really where we're at in real time. The other part I wanted to reference is the family navigator with the service centers, because this is clearly one of the biggest opportunities. The way it's working on the ground, as I have seen it, is Tina Curry in financial assistance, where much of the work for family support actually lies when you spend time talking with EAC members, has been exploring this more deeply with health and wellness. It may be a part of their upcoming service team budget presentations that come forward. And in the meantime, it's also a conversation at that structural leadership table you saw earlier today about service centers, of how do you either incorporate that role or think about adding additional roles into it. And so hopefully at some level, it almost gets dry when we start to talk about structure and process, but at the same time, it's how we go from vision, I think, to action. So I wanted to spend a moment on that, but Sarah and Prince and me, you can make it sound more human and engaging than I did.
It doesn't get dry at all. Thank you so much. That was very informative.
So County Manager, you are correct. One thing I want to clarify is that EAC and TST have not met yet. Our goal is to have those spaces come together, but you are right, County Manager, that we have talked with Danny. We've started those conversations as he took the position as the director of TST. And so we are meeting on a regular basis to onboard one another to the work, right? And so introducing him to the body of work of research at EAC, and the same holds true for TST. Prince and I did attend a meeting last week to talk with the TST group around how we've compensated and worked with the Equity Action Circle. And so from that meeting, I think we will get a group of questions that definitely myself, Prince, and Yi-Chang can go back and present more candidly about the work in the way that we have done here today with you, commissioners and county manager, but to also exchange that information and then hopefully to bring the two groups, governance groups, together to see where we can co-create and build with one another. So that is our path forward and our intention. And so we're really looking forward to more conversation and building together.
Thanks for the intentionality and deliberate focus to ensure that that exchange can happen. So much work going on. Appreciate it.
And Madam Chair, Commissioner Carter, just wanted to lift up as well with our residents first with Karen Schreck and Melinda Donaway with their advisory councils that they presented earlier, how we have recognized the value of working with community, having community at the table, and how they have really incorporated having community as a part of those advisory councils. So as we're talking about like really sharing power with community, that word is getting spread in so many different areas and it's so impactful. Thank you.
Thank you. Moving on, it looks like Commissioner Mattis Castillo has a question.
Yeah, thank you. More a comment. As we've been through this year, I feel like so much has happened, and you managed to cover it all in an hour, which is a miracle, and that's only because Sarah can talk really fast. But I really want to say that, but it is so much, more than just an hour of a recap. It really is about the building of how we move forward. And, as I think about the Equity Action Circle and the amount of work that they have done to help us build a community, you think about, with recovery, we keep talking about building back better. We are already on our way because we have the Equity Action Circle in place, and we're putting us into the right direction to begin with. And so I just really want to say thank you to all of them. I know many are watching, but the work that you've done and that you have built trust with the community on our behalf and together has been really incredible. I'm thinking about all the town halls we've attended over the last year, and they show up to everything, and not just showing up, but participating, ensuring that voice is shared. They're stepping up and stepping back, right, at just the right times. And it's really been fantastic. So I just really, really want to say thank you for that. And I have been on some of those town halls that have not been easy. I remember two in particular that, Prince was getting beat up pretty good when we were having conversations about relationships with the sheriff's office. And the Equity Action Circle was there and had his back. And it was really apparent about how that work is done. We had a really hard one on immigration that Sarah was leading that got hijacked, right, and could have been derailed. And it was very awful and troubling and traumatizing. But because we have this work built in, because we have great leaders like Prince and Sarah and Mi Chang, we are able just to continue and move through at the benefit to our entire community. And so I really think this is an opportunity for us to say, it has been a fantastic year. I think we should provide, in the military, we used to give people who stood up a new command a plank holder award, right? They actually built it. And I feel like our research and our Equity Action Circle are truly our plank holders for Ramsey County as we build back together. And so I want us to continue this work in this way and to add forward and move forward and not think this was a one-time event. I don't want us to get 5 years out to say, remember when we had that team that was great? It should be, this is the way we do our work moving forward. And so thank you for leading it. Thank you all the research members and EAC members and community who keep showing up. It really is truly meaningful for us to get this right as we move into the future.
Thank you, Commissioner Mattis Castillo. And Sarah or Mi Chang, do any of you want to respond? You don't have to, because there are more questions. Great. Commissioner Reinhardt.
Thank you. Well, I have to tell you that the three previous commissioners have said a lot of things that I wanted to say. And so I'm not going to repeat it all, but honestly, having been part of some of those town halls and those discussions that took place, it was truly amazing how the people that were moderating, Prince and others, how you were able to handle it. And uncomfortable is putting it mildly, and you just handled it with such aplomb. I just want to say thank you for that. And what that also meant was not just that you handled it, but what we gleaned from that information and how we can move forward, and not, in some cases, just simply refusing, being respectful and refusing to take the bait. So it takes a lot of courage to do that. And that's how come I think the difference that's being made by the work that's being done through research and through transforming systems together is truly going to be transformational. And I think also, when going back, by the way, you want to change that one date. I think you saw that, so that when it gets posted, that you actually get the credit for the whole year of what you did. But I mean, you had a plan in place, and then COVID, and you switched the plan, and it was almost as if it wasn't just, gee, we've got to switch this. It's, gee, we get to switch this and we can make this happen and we can make it better. And to me, that's one of the things that I really took away from it was the increased participation, the willingness to speak up and to make sure that people had, anybody that wanted to have their voice heard had their voice heard. And sometimes that doesn't always happen when you're in person, depending upon the dynamics in the room. Just plus making it easier for people to get to it because they had to sign in rather than, drive, especially during the winter months and, when it's not nice weather out. So yeah, you not only, as I said, made that transition, but embraced it and made what you had planned even better. So I'm sure you're getting tired of all the accolades, but you've earned them. So that's all I've got. Thank you.
Thank you, Commissioner Reinhardt. Commissioner McGuire.
Thank you. Thank you, Madam Chair. And thanks. I'm going to add my thanks to the whole research team and to the Equity Action Circle. It's, of course, amazing work that you're doing. I want to thank you for your takeaways that you did at the end. That's always helpful. Of course, the whole presentation is a takeaway because it's so packed with information, but I do appreciate the highlighting of what you think we should be taking away. But here's a couple questions. So you have your recommendations, which I love, the family coach model, and just remind me, and if you said it, I just don't remember. Is that going to come back to us in different forms then throughout the year? Is it just, or how, I mean, I'm ready to, just say, yes, go, but just remind me how we're going to see these recommendations come back to us.
Madam Chair and Commissioner McGuire, when you say come back to us, do you mean presented back on like what progress we made, or?
Well, yeah, is this just all going to be implemented now? We don't need any RBAs, or we don't need to, this is just going to be incorporated into what the county does, right? We don't, or are we going to have to formalize this in any other way, is what I'm wondering.
Madam Chair, Commissioner McGuire, I can't tell if Sarah's looking at me or not, but I'll start.
I am, I'm looking down.
Yeah, she's doing should I answer this or not? I'll take a shot at it. I think it's a multifaceted piece. I want to be clear, simply the existence of an ask or recommendations does not make them so. Right. And one of the dangerous things we sometimes do is pat ourselves too early on some of that stuff, whether it's been implemented or not. There were like 100, I'm going to exaggerate maybe. There were like 140 recommendations, I thought, or something in the EAC report, stemming from very targeted pieces to much more expansive work, the family coach being more on the expansive side. If you were just simply to say, let's apply it as within the existing structure, it would require, money and an ongoing funding source, which would make it a budget conversation as a part of it. And that's not to say that it shouldn't be in that conversation at all or anything like that. It's just that would be the process you would go through. Most likely would be a conversation as we move toward this summer and we look at the biennial budget. There are other pieces about on-the-ground service delivery during COVID that have been well underway since the beginning. There have been other pieces around housing stability where FAS worked directly with the subcommittee. Those pieces have been happening as we go, as real time. The last piece I would just say is that I think for a number of years that I've been a part of budget conversations, one of the most frequent things the board asks is how are you engaging community in the development of your budget? And this is a process both by which we want to continue to improve and do more. But part of it is we have this large swath of information over the past year of asks and ways to change and improve in front of us. How do we not lose sight of that while developing a budget? So you don't have the budget people over here and all of this great work over here. And in the near term, that is the biggest focus, is how do you take this these Equity Action Circle recommendations, bring them in with departments and make it not ours and theirs, but our collective path forward.
Thank you for that. I don't know if you want to add any more, but that helps me. I mean, that helps me a lot. So we'll just continue to look for these ways that these manifest themselves in our work, as well as how I'm understanding you're saying that. A couple of other questions, Madam Chair, if I could. Super excited about the early childhood grants and love the family navigator position. Just a question on how the outreach did go. So for the early childhood development grants, did you go through your trusted partners on all of those? Is that how those were brought out to the community? Just curious what our pathways to community are. And you've mentioned our trusted partners, which I love and appreciate. But is there any other way that we get these opportunities for the public to engage in such a thing as an early childhood development grant?
Madam Chair and Commissioner McGuire, so with the early childhood education vouchers, we did share the information with our trusted messengers who shared it through their network, but I would give a really big kudos and shout out to our own internal Ramsey County staff who are working in different programs such as MFib, WIC, and SNAP. I would say because I believe we launched it, like the funding approval for it came in November. And at the point in time, we were like, we got to spend this money by December 30th. So there was a shortened timeline. But within a matter of a week to have over 2,700 parents or caregivers who submitted applications. And we really wanted to reach out to our diverse communities. And I was surprised, honestly, and this was a real learning lesson as well with the shortened amount of time frame, around the number of residents who received vouchers, but also needed additional assistance because English was not their first language. And we also reached out to suburban Ramsey County, their early childhood initiatives as well, because we also wanted to help ensure that we're reaching out to our suburban communities and residents as well. In addition, we also, before even launching, deciding to go with the $300 vouchers, we met with St. Paul Public Schools and their early childhood family education staff to really look at, okay, are we on the right path? We also met with a couple of early childhood education centers to be able to get their feedback around, are we on the right path with putting this out? So I hope that helps answer your question.
That's great. You had a wide range of ways that you brought it out to the community, and I appreciate that. So thank you for that. And then my last question, Madam Chair, is, so when I think of RESERT and the Equity Action Circle, I think of how they were formed during the pandemic here, and that I sometimes hear it referred to as more of a temporary thing, but I don't really think it should be a temporary thing. I mean, I don't think it should be, this we put in place to handle this, but I really want this kind of work obviously needs to be internalized throughout the county. And I've talked to our county manager about this, but if you could just talk a little bit about how this work, did form around our emergency needs and, quick action, and you did all the things that you needed to do. How are we going to formalize this going forward? Could you help me with that again? You've probably said something about this, but.
Madam Chair, Commissioner McGuire, I'll just say, back in March of 2020, this was RESERT and the Equity Action Circle was a dream of Prince and I. And I remember us sitting at Play-Doh in my office. It's still actually on my whiteboard of what we were dreaming up based on the foundation that Maria Sarabi and others had really set, forward in 2017 and beyond. And so I will say that, the takeaways, one of the key takeaways that Prince mentions at the end is that really, the structure of RESERT and the Equity Action Circle is really allowing and helping your race equity administrators really think through, alongside County Manager O'Connor, about how we develop that framework to normalize, organize, and operationalize our work as a county. And so this has really provided learnings, growth, opportunities, and allowed us to identify gaps in how we move this work forward as a county now and into the future. And so COVID provided that opportunity for us to really launch this work. And so I'll just say that as Prince, I think, would mention also of where we started to think more candidly about this as we were building our own capacity internally last year and in years before around this work, to do this work. I also want to mention that, aligning the work back to our racial equity policy is going to be really important as we move forward. And so a lot of what's outlined there is a framework, right? And so we're really trying to balance and lift up how we operationalize the work and also learn from and build from the work of research and the Equity Action Circle. So I wouldn't say it's the end. I would say it's a pivot, and it's really our launching pad to so much more and now and into the future.
I appreciate that. That sounds good. I don't want it to be the end, so I'm glad to hear that. So great. Thank you.
Thank you, Commissioner.
Thank you, Madam Chair.
Ortega, you've been waiting so patiently. Thank you. Commissioner
Commissioner
Ortega.
Fretham, did you say something?
Yes.
We couldn't hear you.
Oh, can you hear me now?
Yes.
Oh, I said, Commissioner Ortega, you've been waiting so patiently. Go right ahead.
It's okay. I thought you mentioned, but then it went out. So I thought you. First of all, let me just echo what everybody has stated. The staff has done a fantastic job. That goes everybody. I don't want to even start going down the list. I just have observations though, and it's funny that Mary Jo brought it up, and that is, and I think I mentioned it today during the board meeting. I got to tell you that the work we've done coming out of this, for whatever reasons, COVID, emergency, whatever, has a lot of positive results. So it's a no-brainer for me that we move forward and sustain that and keep moving in that same direction. But I got to tell you, I think that, I'm not a big person for formalizing. We could vote on 100 resolutions, but if you don't make them happen, they don't mean anything. And what I have observed in the last couple of weeks, I've had several community meetings and there've been public works projects, and the staff here has not necessarily been there. But what I see is internally to Ramsey County, you are being mimicked. People are learning from you in ways that maybe you don't even realize. And it was very interesting to me. The other observation is that community, I think it builds credibility. Because believe me, I could tell you 4 years ago on Randall Street, I would walk into a community meeting and be 100 people just screaming about what they don't want. And now the flavor, the participation I get is people are saying, let's see how we solve this together. It's not antagonistic. It's more about problem solving. And that's where we want to get, because it's not just about meeting with community. That's just another meeting. It's about how the two parties walk away, right? And feel accomplishment and feel that we have a general direction. I just want to make those observations because I think there are a lot of byproducts here that we're not necessarily acknowledging. And this is a place where I think process is in itself a sort of payoff rather than a hard, solid outcome. Just want to keep those scales balanced as we move forward in how we look at this. Thank you for your great work.
Madam Chair, Commissioner Ortega, if I could just say a couple of points. I really appreciate those comments, and to Sarah and Prince and me, a conversation started here, I think in 2015 with the board around, as we look at our own community and the diversity across it, waiting for others to show us the way of building that inclusivity into the way we engage. We can't wait. We can't stand to wait. We need to lead. And so it's great to hear that it may be being mimicked by others, even as we learn and stub our toe along the way and try and get better each time. As Sarah referenced earlier, even with those community meetings and how we needed to change approach into the Latino and Latina community as a part of our COVID response, being one of those moments where like our first efforts didn't fully hit. And then as we pivoted, we got better penetration as we engage with more partners along the way. The one other part about ongoing. So Sarah and Prince and me and I have spoken many times about ongoing and what that looks like. And so that's a piece that we continue to talk about. Structurally, the answer I would give is, like, the racial and health equity administrators are structural long-term ongoing roles in this county. They've been embedded into our work. They are not a COVID creation. And what they are saying, and what you're hearing through this, is they believe there's a role for a cross-county team, currently named Research, to exist with a body from the outside at a governance level known as the Equity Action Circle to guide them in their work. And I think it would be foolish organizationally for us to tell administrators who are telling us how to be successful in those spaces anything other than, like, so let's keep that going. So to me, logically, it makes sense. What I've also observed, and would end on this, what it has done to our system is it has injected a certain level of agitation into the system. And I mean that in a good way, because it's outside of your traditional departmental structures. And it's bringing these issues to the fore from a countywide perspective first. And then we are working in partnership with departments to think about ways to implement. And it's important to have both leaders in departments and leaders outside of departments to truly change. And that's been a learning for me over the past year, of seeing how that tension and balance of agitation and moving together as a team is so important in an area like racial equity work.
Thank you. It looks like Commissioner Reinhardt has another comment or question.
Well, I just wanted to build upon what Ryan was saying, and as far as how we go forward. One of the things that we have made a change in is how involved the chair and vice chair of the budget committee are in this process from the beginning. So know that both Trista and I, working with our CFO, the deputy CFO, the county manager, the deputy county managers, that what we're talking about here today, that we are trying to represent that or play a part in this, representing the board. We meet more often, and I can tell you, I mean, it's very difficult, especially last year when we had to try to get to the zero levy increase, and the work that staff did. That wasn't Trista and I that were able to do that. But one of the things that we did make sure of was that, and we questioned, was that we didn't move away from what we had said we were going to do as far as transforming systems, the community engagement, all of that work, that we weren't going to sacrifice that to get to zero. And so this information here will be carried forward into that discussion, because we've said every time we are working on a budget and presenting it, and it gets presented, it is a moral document. It is where we put our funds and our resources, our talent, ask for volunteers, get grant money, or whatever it is that we're trying to do is reflected in that document, so that we can actually take action where we feel it is needed. And so these recommendations aren't going to sit on a shelf. They're going to be incorporated in all of our discussion. They may not be as, okay, well, let's do 1, 2, and 4, as much as it is, how do we blend this together to get the most we can out of it. Again, those core values of our county, and that this board and the leadership team and everyone that's involved in this has brought forward, is so strong in what we're doing. So I wanted to make sure that you understood that we have changed that budgeting process, and we are much more involved, and we are listening, and hopefully Trista and I'm confident in Trista anyhow, that we bring that voice loud and clear, so that we don't go backwards, and we don't settle for what we can do. We look at how can we make it better.
Thank you, Commissioner Reinhardt. I don't see any other hands, and we are at 3 o'clock. Sarah Holly, it looks like you took your mute off, so maybe I'll turn it over to you to close us off.
Thank you, Madam Chair and Commissioners, County Manager O'Connor. I just want to mention that I think Commissioner McGuire and Commissioner Reinhardt just really lifted this up. that, you know, the work that we've done as a part of Research and the Equity Action Circle, we're looking at the long-term and sustainability and investments that the county can make in this work, right? And so we're trying to move this work beyond COVID-19 in so many ways. And I just want to mention something, Commissioner McGuire, that you mentioned, just circling back to pivot, even to build on what County Manager mentioned, is the fact that, you know, we are working directly with the Equity Action Circle right now to really lift up and prioritize a group of recommendations out of that report, which we will remind and share back out with you all after this workshop today, of what we should move forward on in 2022 and 2023 and beyond, right? And so we know that we want to be intentional and accountable to what community has requested in this co-creation of solutions and priority areas. And so we're really looking forward to doing that during this budget cycle, right? And also long-term. So when we talk about the family coach or the area of housing or the area of procurement and engagement in the area of workforce, right? I think Commissioner Ortega just lifted that up around our public works area. And so we're really being intentional about how we make these alignments and connections to our departments. And we actually started doing that very early on before the report was ever even released with the Equity Action Circle. And so we're building those connections. And I think to Commissioner Ortega's point, we're really seeing where those processes and even our kind of our change in how we frame the narrative and how we are intentional with community and that engagement is really changing in real time. And so we're really looking forward to the sustainability of these priority areas that our Equity Action Circle has lifted up and continuing the work of research above and beyond our COVID-19 response. And it looks like Administrator Corbett is also here, I think, to say a few last words.
Yes, thank you so much. One of the beautiful things about research that I found is that because Administrator Holly, Administrator Chang, and myself represent every single service team and department in the county, how we really have been able to work on breaking down perceived silos within different departments and service teams so that we're able to provide the best services for our residents. And I'm gonna be frank and honest, like out in Maplewood over the past couple of weekends, and I'm sure people have heard about this, like there's been incidences that happened out at one of the shopping malls over the past couple of weekends, and I was out there on one of the nights, and it was about 50 to 60 specifically Black youth that created a law enforcement response. And it happened a couple weekends ago. It happened over this past weekend. And to me, that alerts a issue or a problem. And now it was a concern with our library staff who heard about it. So as we're able to break down silos, it's like, how do we work together to create a response for the youth that are out there, because they need something. Apparently they don't have a lot going on. So how do we pull in our Parks and Recs department, our libraries, other different departments within the county workforce, public health, so that those young people out there have something, because this summer can be very impactful. And I think that's one of the most beautiful things that I've seen coming from research and EAC is how we're able to link connections throughout the entire county when it comes to issues that we may see arise. I appreciate the time and thank you so much.
Thank you, everyone. One last chance if folks want to say anything else. All right. Thank you again, Prince Sarah Michang.
Thank you.
Efforts to our community members on EAC who may still be watching, to our staff members on research who may still be watching. Thank you. Thank you. Your work is so appreciated and your partnership. So have a great afternoon.
Well done.